Hello, everyone. I'm Kibin Alleyne, and today is Tuesday, September 19th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Mental health days have become increasingly popular among adults in the workplace, but could this practice be extended to K-12 and college students? To discuss the potential impact of mental health days on student well-being, I am joined by Dr. Warren Ng, Director of Clinical Services for Child and Adolescent Psychiatry at NewYork-Presbyterian and Columbia University Medical Center. Doctor, thank you so much for joining me.
Thank you so much for having me, Kibin.
Now, can you tell us about the Center for Youth Mental Health at NewYork-Presbyterian?
The Center of Youth Mental Health at NewYork-Presbyterian Hospital used to be called the Youth Anxiety Center, and it was created over 10 years ago, really to acknowledge the need of mental health care as well as education research for young people. So I think it's a wonderful collaboration that NewYork-Presbyterian Hospital has had with both Weill Cornell Medicine as well as Columbia University Evangelos College of Physicians and Surgeons. So it's really trying to bring together the best of cutting-edge research with state-of-the-art care, as well as with health education and promotion.
Now, I think in regard to mental health, our society, we're always evolving and learning more. And I think that also extends to how we address mental health in children and young adults and teens. Can you just talk about how our society overall has addressed, this challenge many children, teens, and even young adults are facing?
That's such a great question. And I know one of the things that we appreciate, particularly within the mental health community, is that we've actually been having a silent pandemic of children's mental health issues even before the pandemic. And I think the pandemic only made things worse. I think that where we are as a society is that we're finally waking up to acknowledge what's been going on for our children, youth, and young adults. So I think one of those things has been, it's very important for our sort of the doctor of our country, our Surgeon General, Dr. Vivek Murthy, to acknowledge that there's a health advisory on protecting youth mental health. And I think that there's just a greater awareness that our young people are suffering and how can we best respond to their cries for help.
Now, you mentioned that COVID could have possibly amplified that. Can you just quickly touch on that?
Sure. I think that the pandemic has been incredibly difficult for all of us, but particularly for young people. And some of those studies that have been looking at our young people, and one of them is our Centers for Disease and Control's Youth Risk Behavior Survey, surveying 17,000 high school students, has really demonstrated that for our young people, they're really having a hard time, with half of all high schoolers really acknowledging persistent feelings of sadness as well as hopelessness, and 2/3 of adolescent girls. And it's even higher when we think about our youth of color, as well as our sexual and gender minority youth.
Now, I want to talk about mental health days. As I mentioned, they have become increasingly popular for adults in the workplace, and I think that's an amazing step forward. Can you just talk about some of the overall benefits of acknowledging mental health in your workplace? Because I think previously that was considered something that you mostly just kept to yourself. Can you just talk about the benefit of just acknowledging that this is something that many people go through in the workplace?
I think it's a critical question. And actually, one of our former Surgeon Generals, Dr. David Satcher, said that there's no health without mental health. And I think it's really being able to bring our whole humanity into our experiences, not only in the workplace, but also at school and at home and where we are. And so we need to definitely think about our health and well-being, and also our mental health as being a critical part of that. Because if you're depressed or anxious or preoccupied, how are you learning in school? How are you doing your best work if you're working? And I think it's being able to acknowledge the importance of that, and also addressing the stigma that often gets in the way. And there's a former president who said that, there is no shame in mental illness, but shame and bias really affect all of us.
Now, what would a mental health day look like for a school age, kid or a teenager, or even a young adult, specifically those ages 15 to 24?
Well, first, it's acknowledging that how important it is and that it exists. But I think increasingly, it's about parents and adults or caregivers of young people, children, adolescents, really asking them the question how they're doing, and really taking the time to listen. and also to understand that they may be going through something that we are not expecting. So be prepared for not only good news, but bad news. And I think part of how we can think about a mental health day for a young person is first checking in with them how they're doing, but also acknowledging that if you're going to be taking time out of school, we want to be proactive about helping them feel better. So first, it's listening and learning from the young person, and then thinking about strategies on how can we improve our connectedness with that young person, having them feel heard, seen, and understood. And then if they need additional help, then being able to do that in terms of reaching out to their school provider, their mental health provider, their health provider, or their community resources.
Now, I kind of wanted to expand on that, on basically how this could strengthen a parent-child relationship. I know for a very long time, whenever a child or a teenager said, I feel sick, I don't want to go to school, a parent's automatic thing is like, no, you're going to school. Why might they may actually want to reconsider that response, and how could it actually strengthen their relationship?
Well, I think it goes right back to, Kibin, what you had asked earlier. It's about the connection. It's about the understanding. And that relationship is key. We know that for young people, feeling connected with someone in their life is really a lifesaver. There was a wonderful study that looked at the adolescent behaviors experiences, which looked at you could decrease suicide risk in young people when they acknowledge that there's someone that they're connected to in their life. And I think that who is more important than your parent or caregiver? So being understood and understanding that if you're having a difficult time, that you can share that with someone who loves and cares for you to be able to get the help that you need. And so that relationship is life-saving. That relationship is the world. There's this wonderful quote actually from Dr. Seuss. It says, to the world you may be one person, but to one person you may be the world. And that's exactly, I think, the message that we want parents to have when they're thinking about their young people.
Now, can you talk about maybe how parents or adults may struggle to acknowledge that their kids may have mental health challenges and possibly some guilt that goes along with that? Because I could imagine that's also maybe a journey that they have to kind of go through, knowing that their child may be struggling with that.
That's also a great question, because first we have to deal with ourselves and acknowledge that we may have stigma biases related to mental health and mental illness. And being able to acknowledge that we have to accept that for ourselves in order to help another. And I think that being able to have that dialogue is so important. But being able to acknowledge that there is help, mental health treatment works. But what's really important is being able to ask the questions, learn from the young people, and also know how to seek help, because there are many different ways of doing that.
Now, whether you're a parent or maybe an older sister or an aunt or uncle, how can you validate a teenager's experience or, a young adult's experience with mental health issues?
Well, first is just how common it is. I mean, 1 in 5 people, particularly young people, live with a mental health or developmental issue at any given time. And that's 1 in 5. So just look around the room and you see 5 people, someone is suffering or experiencing some difficulty. So understanding how universal it is one thing. And also acknowledging that we know that for young people right now, they are going through a difficult time. We have a national crisis of children's mental health, and acknowledging that they are not alone. It's important to know that there are experiences that other young people are going through, and how can we normalize it, and how can we make sure that we integrate mental health into their health as well as their whole sense of well-being.
Now, a mental health day could be a little bit more challenging for somebody who's in college, where taking the day off isn't as easy. How could they navigate prioritizing their mental health?
Well, I think first is really checking in with yourself to understand where you are, because if you're having a mental health issue that is affecting you, it's going to affect how well you learn, how you pay attention in that day. So how much are we going to get out of it? And it's important for young people to know that there are resources within their schools, within their campuses, in terms of getting more help. And if they have, they want help in articulating sort of why they need a mental health day, those resources are also available. But it's also acknowledging that when you don't take a mental health day when you need it, you're going to needed something else later. And it's really a question of postponing what is most helpful, and that isn't helpful. But I know that at any given time, we are all busy, but are we taking time out for ourselves? And do we understand that if we're not taking care of ourselves, we're not going to be able to do all of the wonderful things we want to do, and also to be able to do them to the best of our ability?
Now, what are some signs parents should look for in their teen to understand that they may need some extra support? And I also want to extend that over to, let's say, if the person's in college, if you notice your friend what can you look for to notice, like, hey, I think they may need some extra support?
Well, I think so much of what we see on the outside may not really be what is on the inside. So I think we have to be curious. Some of the signs that we often think about, and you had this wonderful question earlier on around the Mental Health Day, a lot of times we experience our mental health issues or our feelings or thoughts also through our bodies. So we might have a headache, we might have a stomach ache, we might feel fatigued. And all of those are also additional signs that our body's trying to tell us something that we may have a difficult time accepting. So mental health issues can also sort of be presented through physical and somatic symptoms. And so being able to acknowledge that. In terms of the signs and symptoms that we look for, sometimes it's really looking at how does that person present? How do they look to us? Are they having any difficulty with their sleeping or their eating or some of the really core functions? Are they isolating themselves? Are they not doing the things that they usually enjoy? Are they not seeking out their friends or social activities in the usual ways that they are doing it? And so those are all different signs, but I also want to say that don't be fooled. Sometimes because of stigma and shame, people want to put up a good face. And I think that that's also an acknowledgement for us to be alert, be curious, and sort of go beyond the surface, because that's really where the feelings are.
Well, Doctor, I want to thank you so much for joining us and having this conversation, and I hope we continue to have conversations like this.
Well, thank you for starting it.
To learn more about New York-Presbyterian's effort on mental health in children and adolescents, please go to their website at www.nyp.org/youth mental health. Don't go away. We'll be back with more after this.